Hello, thanks for joining us again today. I will give you, to start with, the daily statistics. The total number of positive cases reported yesterday was 961. That is 17.1% of people newly tested and takes the total number of cases to 39,959. 359 of the cases are in Greater Glasgow and Clyde, 244 in Lanarkshire, 112 in Lothian and 88 in Ayrshire and Arran. The remaining cases are spread across 8 other health board areas. The only health boards without cases today are Orkney and Shetland. I can also confirm that 487 people are currently in hospital, which is an increase of 38 since yesterday. And 36 people are in intensive care. That's one more than yesterday. And it is important to stress, in light of particularly the hospital number that I've just given you there, that rising hospital admissions was a factor in our decision to take action and bring in temporary restrictions last week. Finally, in the past 24 hours, no additional deaths were registered of patients first testing positive within the previous 28 days. However, I would remind you again that registration offices are largely closed on a Sunday, so that is not an unexpected figure to be reporting today. Since the last briefing on Friday, though, 6 additional deaths have been registered, which means that the total number of deaths under the measurement we use in these daily figures is now 2,550. Again, that reminds us that this can be a deadly virus for some people, and I want again to send my thoughts to everybody who has lost a loved one, and in particular to those who have been bereaved in recent days. There's 3 issues I want to cover briefly today, and then the Health Secretary is going to say a word or two before I and the Chief Medical Officer take questions. The first thing I want to reflect on is that the weekend just passed, of course, was the first with new temporary restrictions in place. So I thought it was appropriate to start simply by saying thank you to individuals and businesses across the country. The anecdotal evidence, early anecdotal evidence we have so far from the police would suggest that compliance with the new rules and with rules generally over the weekend has been good. That's encouraging. These new restrictions are really tough for everybody, and they are tough for businesses, particularly in the hospitality sector. Nobody is unaware of that. But they are vital for helping to stem the increase in cases, bring it back under control, and of course stem the increase in hospital admissions and illness that we have been seeing. So it is really important that everybody sticks with them, because if people don't stick with them, they will not be as effective as they need to be. So the initial signs from the weekend suggest that that is happening, and is the reason that I want to say a very big thank you to everybody across the country. Second point to update on is that I've just not long ago come from a COBRA meeting with the Prime Minister and the leaders of the other devolved governments. The main topic of discussion this morning was the UK Government's proposal for a 3-tier system of alerts for different parts of England. We saw the detail of their proposal this morning, but we will look at it very closely. As I said to Parliament last week, we intend to develop our own tiering framework and take that to Parliament after the October recess. And of course, that will coincide with the ending of the temporary reset restrictions announced last week. At a strategic level, we will be looking to align as closely as possible with the other UK nations. I think it is important, and it makes sense to try to do that. Though I would stress that operational decisions about which tiers might apply in which parts of our nations will be for each of us to take at a devolved level. The publication of a new framework will be a key step to guide us through the next phase of the pandemic, but it's by no means the only step we'll be taking over the next couple of weeks. What we want to do is ensure that these temporary restrictions don't simply slow or reverse the increase in cases for a while, although that is clearly important, before things return to normal or as they were before these restrictions afterwards. What we want to do is use the 2 weeks to secure a longer term benefit and greater resilience, as we know we will be living with this virus for some time yet to come. So, for example, as I indicated last week, later this week we'll introduce new regulations to extend the mandatory use of face coverings in indoor communal settings, for example, staff canteens and corridors in workplaces. We're also going to be taking action to strengthen compliance with the different strands of the facts advice. That will focus particularly on self-isolation because that is so essential to reducing and preventing transmission. But it is also an area where we know, for understandable reasons, that compliance is not yet as high as we need it to be. And we are also talking to different sectors of the economy, including hospitality and retail, to help them ensure that they can operate even more safely in future. For example, we have already asked shops to return to 2-metre physical distancing and to reintroduce other measures such as one-way systems that they had in place earlier on in the pandemic. And finally, as I said last week in Parliament, we are reviewing again our testing strategy. As we continue to expand our testing capacity, we're looking at the basis on which we would test more people, including groups of people who don't have symptoms, but who may, if the virus is not detected, help to generate or risk community transmission or transmission where people are vulnerable. So we'll be working hard over the next 2 weeks to further improve how we control the pandemic while living as freely as possible for individuals and businesses. And we will be seeking to ensure that as we exit the reset restrictions 2 weeks from now, we do that on a more resilient footing. But as ever, and this will be the point I close on, government measures can't work on their own. They're really important, but we all need to play our part in getting and keeping the virus under control. That gets harder as the months go on for all of us. I think we are all acutely aware of that right now, and I'm sure it has seemed especially difficult over the most recent weekend as new restrictions came into force. But I want to make a special plea today to everybody to continue to stick to all of the rules and the guidance. Please don't think that it is safe to cut corners. I know just how tempting it is to visit friends or family right now or have them visit us. And I know that it might feel that on any individual occasion one of us does that, it's harmless, but it's not harmless because every time one of us does that, we are giving the virus the opportunity to spread from one household to another. And we know that is the big risk that we face right now. The fact is, the virus is spreading too rapidly right now from household to household, and that is the key issue that we are trying to address. So please do stick to that very important rule and don't visit other people in their homes at the moment. Also, as you know, and as I've been reflecting on, there are additional restrictions on hospitality across the country right now, but particularly in 5 health board regions: Lothian, Lanarkshire, Forth Valley, Ayrshire and Arran and Greater Glasgow and Clyde. And in addition to the hospitality restrictions in these health board areas, we're asking people who live in these areas not to travel outside them if they don't need to. So if you live in Greater Glasgow and Clyde, don't travel outside Greater Glasgow and Clyde if you don't really need to. We're not insisting that people cancel October holiday plans, but we are asking more generally, please avoid travel that you don't need to take to different parts of Scotland or to different parts of the UK. And in addition to that, and this applies to people across Scotland, when you do travel, please be very careful. Be especially cautious if you're travelling, whether that's in Scotland or elsewhere in the UK, to places that are seeing high rates of infection. We've seen a number of COVID cases in recent weeks coming through our Test and Protect system, which have been associated with travel, often coach travel to other parts of the UK. And so that underlines how important it is to be careful. Make sure you're wearing face coverings, observing physical distancing and taking all other precautionary measures. Alongside these guidelines on travel, there are, of course, other important rules that apply to everyone across Scotland, no matter where we live. As I said a moment ago, please don't visit other people's homes right now, except for very specific purposes like childcare or caring for a vulnerable person. I know that's a tough restriction, but it is possibly the most important one that we're all being asked to comply with right now. When we do meet outdoors or in indoor public places like cafes, the maximum group size should be 6, and those 6 people should come from no more than 2 different households. Work from home if you can. Download the Protect Scotland app if you haven't done that already. And finally, Remember facts. These are the key bits of advice that if we all follow, we will reduce the chances the virus has to spread. So wear face coverings when you're out and about, but particularly in closed spaces. Avoid crowded places, clean your hands and clean hard surfaces. 2 metres distance from other households, and self-isolate and get tested if you have any of the symptoms. These are the rules that help us look after ourselves and minimise our own risk of getting COVID, but also the rules that help us look after each other and minimise the risk of any of us inadvertently passing it on to someone else. And if all of us follow these rules, then each one of us will play our part in the collective endeavour of keeping the virus under control. So thanks again to everybody for continuing to abide by these rules, and please help spread the word to others and encourage them to do so as well. I'll pass over now to the Health Secretary to say a few words before we move straight on to questions.
Thank you very much, First Minister. Care home residents and their loved ones, of course, want to see each other as much as possible. And we've been very conscious that visiting restrictions have been very difficult for residents and their loved ones over the last few months. So I'm pleased that today I can announce updated guidance on care home visiting. You know that we've been working closely with Scottish Care and others on a staged approach to reintroduce visiting in care homes as safely as possible while COVID remains in Scotland. All of that work has been closely informed by clinical advice, and we try very hard to balance protection of residents from the harm of COVID with quality of life. And that is never an easy balance to strike. But listening to family members, carers and clinicians, I believe the updated guidance published today provides additional advice to help care homes better balance safety with the need for family and visitor contact. It offers greater flexibility for indoor visiting in particular. The guidance recommends easing restrictions in a number of ways, including extending indoor visits from 30 minutes to up to 4 hours. Outdoor visits too can be extended to include up to 6 visitors from no more than 2 households, including children and young people, and for up to 1 hour per visit. The new guidance also supports increased personal interaction, touch, including holding hands. Again, as long as strict PPE and infection prevention control measures are met. Having spoken to care home relatives, I know how much they appreciate and will comply with these infection prevention measures, precisely because of the love they have for their family member. We've also taken the opportunity to provide more clarity and flexibility on essential visits. These are exactly what they say, essential. They should always be permitted, with appropriate infection prevention and control steps in place, of course, but they're incredibly important for people's health and well-being and should be supported to prevent or respond to a lessening in residents' health, to help communicate when they're in distress, and to allow important time with loved ones in circumstances where a resident is approaching the end of life. Essential visits should be supported safely and generously, and care homes can draw on local support to put these in place where needed. Other changes also include support to visits by spiritual and faith representatives, hairdressers, pets and therapists, as well as safely bringing in certain kinds of gifts and residents' belongings. As always, care homes must be COVID-free for 28 days and be fully taking part in the weekly care home staff testing programme. In writing to care homes today, I've also taken the opportunity to update them on our work which is underway to transition staff testing from the UK Lighthouse programme to our own NHS labs. The guidance, along with updated visiting leaflet, can be found on the Scottish Government website. And of course, the Clinical and Professional Advisory Group, chaired by members of the Chief Medical Officer and Chief Nursing Officer Directorates, will continue to keep guidance under review as we progress through this pandemic, taking account of changes in COVID-19 circumstances and providing their advice to me. I hope that what I have been able to announce today will give relatives and, importantly, residents some opportunity for greater and more meaningful contact. Thank you.
Thanks, Jeane. We'll move straight to questions. David Henderson from the BBC.
Thank you, First Minister. With the epidemic clearly picking up pace across the rest of the UK and showing no signs of disappearing in Scotland, do you think it's now all but inevitable that we will soon need tighter restrictions in Scotland, lasting not just a couple of weeks, but perhaps several months, even through the winter? And with that in mind, do you still plan to allow pubs and restaurants across Scotland's central belt to reopen in 2 weeks' time, or has that timetable already been overtaken by events?
No is the answer to both strands of that question. No, I don't think tighter restrictions than the ones we have in place right now in Scotland are inevitable. In a pandemic, nor can anything be absolutely ruled out, but I absolutely emphatically don't think that that is inevitable, and I'll come back to that briefly in a second. And secondly, no, the timetable that we set out on Wednesday last week has not already been overtaken. These are temporary reset restrictions to try, as at a relatively early stage, in a preventative way to stop the virus spiralling further out of control, and they are intended to be in place for 2 weeks and to lift at that 2-week period. What I've said today, indicated this last week, but gone into a bit more detail today, we intend, as we come out of those restrictions, to put in place the strategic framework, which will have tiers of intervention that will allow us to respond flexibly, depending on the spread of the virus, either nationally or in different parts of the country. But I think it is really important that we recognise that we have sought with these reset restrictions to act quickly to try to prevent longer lasting or tighter restrictions being necessary in future. We in Scotland, we obviously had Four Nations discussions at Cobra earlier. We are concerned about the rate of spread. We set out some evidence last week about the doubling time in Scotland right now, and what we might be looking at by the end of this month if we do nothing, which could be a return to the March peak of cases that we saw. But actually, in a UK context, we've taken this action quite early because our case numbers per 100,000 of the population is a bit lower than it is in many other parts of the UK. So this is it's a necessary measure, but a preventative measure by intention. And just on the point about inevitability, we are going to be living with this virus for a while to come. Hopefully, science will ride to our rescue through a vaccine and better treatments along the way. But we are going to be living with the virus for a while yet. And what we need to continue to do, as we are already doing to some extent, is live with the virus so that we can keep it under control, help by test and protect through the basic things we all do, and have as few restrictions of the type that we announced last week in place as possible. So we're not going to, next week or in 2 weeks' time, be able to go back completely to normal. The need for us all to physically distance, to wash our hands, to wear face coverings, to work from home where possible, to have all of these mitigations in place is going to continue for some time. But if we all do all of these things, and if we all comply strictly with all of these things, we will hopefully reduce the need for the heavier restrictions that are more associated with lockdown than in the future than we have seen in the past. Gregor, do you want to add anything about?
So I think all of us would realise that as we come into the kind of late autumn and winter period, we're coming into a period of the year when people spend much more time indoors than outdoors, and that's an environment that is associated with a greater likelihood and risk of transmission. So I think all of us recognise that this next period in front of us was always going to be a difficult and challenging time, and that's one of the reasons we've taken the action just now to try to prevent the need for those further more draconian measures in the future by making sure that we act at a point in time before the epidemiology is running away from us. When we look at the epidemiology around Scotland just now, the levels that we're seeing, the cumulative case incidence in our Scottish local authorities are at a lower level than perhaps some of those comparable areas where restrictions are being considered in other parts of the UK. And that's principally to do two things. First of all, is to reduce the rate of growth that we have in those areas just now, to slow down the risk of transmission before we enter that period. And the second thing that we can do at this point in time, as everyone kind of takes on these new restrictions and follows them, is to reduce the disease pool that exists across the country as well, to have fewer people in circulation with COVID-19 as well, so that there's less likelihood of passing that on as well. And if we do that just now, and if we follow these restrictions, then I believe that we'll have much greater chance of avoiding much more severe restrictions as we go through the months ahead.
Thanks. Gordon Cree from STV.
Thank you, First Minister. It's been an odd few days. It's become clear that your harshest critics think you do nothing right and that people like me never ask any hard questions. It's also become clear your most enthusiastic fans think you can do nothing wrong and that people like me are, I quote, imbeciles who dare to ask moronic questions. Does it sadden you that a fair chunk of people view what you or Boris Johnson or other leaders do about COVID through a party, political or constitutional prism rather than as a public health emergency? And if I can ask all of you, with some experts saying at the weekend the virus is here for years, what needs to be the strategic aim, or are we stuck with reactive imposing and lifting of restrictions in a cycle?
Thanks, Gordon. I'll do my best to answer the first part of your question. Maybe Gregor is better placed to take on the second bit of your question about the cycles and the longevity of the virus. Can I say, for the record, you do ask hard questions, all journalists here do, and ask legitimately and good questions that are rightly hard. I don't have any complaint or objection to that. That's part of the reason that I stand here every day, to get across messages, but also to allow those messages to be scrutinised, challenged, at times elucidated. And I think it's an important part of the process that we are going through. I think the vast majority of people see this through a public health prism, first, last and only. And that's the way we should see it. I've tried very hard all along not to take these decisions in a political or constitutional context, because I don't think that would be appropriate. Clearly some people will always be suspicious that that's what I'm doing. There will be some people at the other end of the spectrum who think I should be doing that, but this is a public health challenge. And given that it's a public health challenge, the approach we take to combat it must be driven by public health considerations. And I think the vast majority of people recognise that. But democracy isn't suspended, and people are entitled to think I get nothing right, and of course people are entitled to think I get everything right as well, but neither of these things are true, incidentally. We're all trying our best right now to make the best decisions and get these things as right as possible, but it's a difficult situation that I've certainly never led a country through before, and I don't think any leader has led a country through, so we will make mistakes. I've made mistakes, I'll make more mistakes. I try to avoid that and try to learn from those that we do make. This is a horrendously difficult situation for everybody, and it gets harder for everybody the longer it goes on, and I recognise that. I feel it harder the longer it goes on, although it hasn't been easy at any stage. And I don't mean this to sound trite or cliched or anything, but I think it is really important that we do remind ourselves on a daily basis that we're all going through this together. Yes, it is harder for some people than it is for others because of, socioeconomic circumstances or the particular, circumstances in which people are living. But we are all in this together, not just in Scotland, but across the UK, across the world, and just trying to be understanding of the challenges we're all facing, including journalists trying to report on a complex, fast-moving situation, I think would stand us all in good stead. And hopefully that's what the vast majority of people do. But to those who might want to see things differently, let's remember this is a tough situation of nobody's making, and we'll get through it better and stronger if we just try to cut each other a bit of slack sometimes. Gregor, do you want to hopefully tell Gordon and me that it's not going to last for years?
I wish I could say that, but I do think that we will be living with the virus that causes COVID-19, SARS-CoV-2 for years to come. However, what I will say is I don't think we will be living as we are just now with this virus, because I think over time what we've seen with all sorts of other infectious diseases as they've emerged is that as gradually we've found ways of dealing with them, whether that be through treatments or by vaccine, we evolve our approach to how they impact on us in our everyday lives. And I'm very confident that that's exactly what we'll see with SARS-CoV-2 and COVID-19 as a disease as well, is that over time we will gradually be able to change our approach as to how we live with it on a day-to-day basis as better vaccines come on board, as we understand more about how long immunity lasts for, and as more and more treatments are available to us as we treat the underlying disease COVID-19 as well. So yes, I think it's likely that the virus will become endemic, but I don't think that we'll be living like this over many, many years at all. I think that the way that we approach things will change over the coming months and years, as particularly as those vaccines become available to us.
Thanks. Bruce Mackenzie from ITV Border.
Thanks very much, First Minister. We heard over the weekend that the local health authority in Dumfries and Galloway was watching the Stranraer area very closely after what it called a significant number of cases there, visiting suspended at the Galloway Community Hospital and at care homes in the area. I wondered, first of all, how much of a concern that rise in cases in that area is. And also across Dumfries and Galloway, we're seeing case numbers rise at a rate, twice the speed they were at the start of April. Should people in Dumfries and Galloway be prepared, perhaps, to face the same restrictions that we're seeing in neighbouring areas in the Central Belt?
Okay, thanks. Jeane and Gregor may want to add. We are concerned about the rise in cases in all parts of Scotland. So, that is the reason that last week we took decisions to introduce stricter restrictions in the 5 health board areas across the Central Belt, but didn't do nothing in the rest of Scotland, because we see a particularly pronounced challenge in the Central Belt areas, but we see a rise in cases everywhere. As I said earlier on, the only parts of Scotland where that is not the case at the moment is Orkney and Shetland, although they've had cases. So we need to understand that this is a situation we should take seriously in every part of the country. I go back to my answer to David Henderson's question, though. We've got to be very vigilant. We've got to take all this seriously. We've got to do all of the right things. But I think it's really important, and perhaps it's a way of motivating ourselves to do the right things, is we shouldn't consider anything to be inevitable in the fight against this virus, because we know how to stop it spreading. Now, sometimes with the best will in the world, no matter whether we do all of the things that I stand here every day and talk about or not, it will jump from person to person. It's an infectious virus. But we know the things we have to do to try to minimise that and to stop it spreading as far as possible. So people in Dumfries and Galloway, if you comply with all of these things, if you comply with the restrictions currently in place, all of the public health rules and guidance, facts, the face coverings, staying away from crowded places, hand hygiene, 2 metres distancing, isolating and getting tested if you've got symptoms, then there is a prospect of stopping having to have stricter restrictions. So that is what I would say to everybody right now. The more we comply, the less chance there is in any part of the country that we'll have to go into a period where things get tougher rather than starting to ease up again. If you want to add anything about the hospital context.
Yeah, thanks, First Minister. I'd say a couple of things about the situation. One, that we are very aware of it and are monitoring that closely. The local health protection and public health team acted very quickly to test and protect, is very active there to contain the number of cases and prevent spread. As the First Minister said, the compliance of everyone in and around that whole area with the measures that we've put in place and what we ask people to do is really important. And of course, the Health Board took the right decision in terms of suspending all but essential visits. Essential visits will still be possible in the hospital and the 2 care homes in the particular locus, because they want to protect those who are most vulnerable from harm if they catch the virus. That's the point of doing that. And that will happen from time to time, notwithstanding what the guidance is around hospital or care home visiting. From time to time, the local health board, local health protection team, Director of Public Health will take those decisions for a limited period in order to protect people who are most vulnerable from being seriously harmed if they catch the virus.
So at this point in time, I want to pay tribute to what is a wonderful network of health protection specialists that we have across Scotland just now, who feed into the work in how we understand better these rising cases in areas. Now, they do that through the formation of local incident management teams, which also feeds into a national incident management team as well. And their analysis of the data at a local level, their local intelligence, allows us much better insights as to why we have rising cases in one area. So it's important not just to see the cases just as a figure, but actually to understand why it's happening behind that. For instance, is it associated with a recognised, constrained outbreak? Or does it represent wider community transmission where you've got sporadic cases that you don't fully understand? And that's what these local health protection teams do. They allow that understanding, and then they can shape the measures that are necessary according to the need for that particular area. And that's the work that is going on not only in Dumfries and Galloway, but right across the country just now, so we can have confidence in what the data is actually telling us and respond accordingly, appropriately, and probably the most important thing, proportionately to the need in that area.
Thanks, Gregor. Alan Smith from Bauer.
Thank you, First Minister. At least 17 businesses were closed by Glasgow City Council across the weekend. Radio Clyde has spoken with many of them, including Epicure's staff there in disbelief as they've been operating as a cafe for months before these restrictions were announced. Many honest businesses who aren't trying to bend the rules are being closed because of, in the words of Glasgow City Council in its statement, it's not within the spirit of the regulations to continue to trade. Should councils be more definitive or explain more clearly their decisions rather than talking about the spirit of the regulations? And is this not just another example that there remains genuine confusion about these restrictions?
As I said on Friday, we have tried to have an exemption, a genuine exemption for cafes because of the social isolation and loneliness issues that I've covered. And we've tried to avoid an unfairness between cafes that have a licence and cafes who don't. Now, it would have been an alternative approach, which is the one we started with, just to say any business with a licence, including cafes with a licence, had to close. So we've tried to give a bit of flexibility, and as I conceded on Friday, yes, that means that there are judgments that have to be made around the definition, and that's not easy. But the kind of cafes that are finding themselves closed because the judgment of local councils is that they fall outside the exemption would be closed had we taken the harder road as well. And I suppose the appeal I want to make, and it is an appeal because I really do understand how horrendous this is for business owners, and I don't want to minimise that in any way at all. But what we are trying to do here for a 2-week period is to reduce the places where people are coming together and risking the transmission of the virus. We've already asked people not to go into other people's houses. It's really tough. The other place where people are likely to come together, sometimes in settings with ventilation that is not particularly good, where it may be a bit more crowded, where different households of different ages are mixing, are in hospitality premises. So it's a volume thing as well as a nature of the particular hospitality section that a business is in. And difficult though it is, I'm asking businesses to work with us over this next two-week period, because if we manage to blunt the increase of cases, then we can come out of this in 2 weeks, as is the intention, and go into a period where there is much more freedom around how businesses are operating. But it is essential to blunt this increase, which is why we have done this and why we're doing it in a way that attacks the volume of premises in the way that we have. Of course, we've also put in place financial support mechanisms. The detail of this was announced after my briefing on Friday. We were waiting for the Chancellor's announcement around furlough, and we have put in place a grant scheme for businesses that are by law required to close or by law having to restrict their operations. We have a part of that funding scheme that will top up the furlough support that is available to businesses to pay wages, and we're also making money available to local authorities to allocate on a more discretionary basis, where businesses who are being impacted by these regulations but don't fall into one of the firm categories are having difficulties and need support. So I really do. I know how difficult this is, but I'm asking businesses, just like I'm asking all individuals, to work with us over this reset period to try to get ourselves, with all the work we'll do during this period, into a more resilient place at the end of it, so that businesses can start to trade more freely again as we go further into the winter period. Fraser Knight from Global.
Thank you, Minister. We've heard this morning that NHS Nightingale hospitals in parts of the north of England are being mobilised to accept COVID patients again with the amount of cases that are appearing there. And we've also heard all NHS workers in high-risk areas in England will be offered routine testing, whether they have symptoms or not. I was wondering if you could tell us what the latest situation is with the NHS Louisa Jordan Hospital. Is it posed to receive COVID patients immediately? And as we still see outbreaks in some hospitals in Scotland, there's a ward closed in the Queen Elizabeth University Hospital just now to new admissions because of an outbreak. Where do we stand with routine testing of all NHS workers, whether they have symptoms or not?
Thanks, Fraser. I'll hand over to the Health Secretary in a second. Just briefly, we already test groups of patients and staff depending on risk and vulnerability. The Health Secretary and Chief Medical Officer and I, as it happens, have a discussion about the updating of our testing strategy later this afternoon, and the issue of testing further groups of NHS workers will be very much a part of the discussion that we are having, and obviously we'll update once that work has been completed. We are not anticipating that the NHS Louisa Jordan will be receiving COVID patients immediately. The Health Secretary will say more about the preparedness there and of the health service generally. But of course we are concerned about rising hospital admissions, over 400 announced today. And that is one of the reasons that we have acted early with measures to try to get infection back to stop the rise in infections that we're seeing right now. What I heard Deputy Chief Medical Officer in England, Jonathan Van Tam, say this earlier on, and it is true here, that because of the lag effect, the hospital admissions that we're seeing right now will be people who were infected some time ago, so there is always, it will always take longer to see that reduce after you start to reduce infections. But these measures are about bringing infections, the increased infections under control, so that we stem over the weeks to come that continued increase in hospital admissions, because we all hope that we don't ever have to see COVID patients treated in the Louisa Jordan, although it's really important that it is there as a contingency.
Thanks, First Minister. I'm sure you remember that when we've talked before about remobilising our NHS as we came out of the months of March, April, May, June, and began to look at how we could safely restart some areas of healthcare that had been paused during that period, we said very clearly at that point that all our boards had to retain capacity to deal with an increased number of COVID-19 cases, both in wards, but also in ICU. And boards have done that. They have held that capacity there, that they can stand it up very quickly, and we are seeing in the numbers that are reported that they are very able to do that. So that remains the case. The NHS Louisa Jordan is there and can be stood up within a very short period of time. So it remains there for us to use if we need to. But right at the moment, it is being used to help us with that remobilisation, excuse me, of the NHS by undertaking a number of treatments and procedures that only require one day, that can be done very safely there in the interim. But should we need the Louisa Jordan, it is there for us to use, but our boards are all working with that capacity held to be able to use that if we need to, if case numbers increase.
Thanks. Charles Fletcher from Caledonia Media.
Thank you, First Minister. Good afternoon. It's local radio day today, and community radio stations from Dumfries to Portree carry your briefing live. Our listeners understand the need for the extended regulations or restrictions, but many are asking us when and if you plan to enforce them more vigorously to help ensure greater compliance.
Thanks, Charles. There is always a very careful balance to be struck between encouragement and support and enforcement. And at times we will need to use enforcement, but we want to try and avoid that by encouraging people to do the right thing for the right reasons. The police, as they do regularly, will issue the statistics on things like fixed penalty notices that they've had to issue for house parties or people breaching the regulations more generally. So enforcement has a part to play, and we will continue to look at whether there is a need to increase enforcement. Now, that could either be taking things that are currently encapsulated in guidance and making them the law so that they come with enforcement and penalties, or where things are already the law, increasing the penalties for breach. And we keep all of that under review on an ongoing basis. But by and large, we prefer, and I prefer, to encourage people, and where necessary, as we're doing with the payment for self-isolation, to support people to be able to comply with these things, because it goes back to what I said earlier on. We are all in this thing together, and doing the right thing for our own sake and for the sake of each other, I think, is what we should seek to encourage people to do. Thanks, Charles. Neil Pooran from PA.
Thanks, First Minister. You mentioned earlier there was a number of cases connected with coach travel. I was wondering if you have any more details on this, and if there's evidence that there was transmissions on the coaches themselves, and should we be concerned anymore about public transport in general, places like city buses?
There, as you've heard us say before, it is not always possible to be definitive when we have the data that comes through the interviews done by Test and Protect to know exactly where somebody got it. So, just to recap, when somebody tests positive, Test and Protect, the contact tracers there will speak to that person and ask them where they've been in the previous few days. And people will report maybe being at work, or being on a coach trip, or, being, before we imposed the restrictions in the Central Belt, in hospitality. It's not always possible to say at which place they actually got it, but it allows you to build a picture of the themes and the kinds of exposures that people are having. And what we have seen is that coach travel, this is a time of year when people will often go on coach trips to other parts of the UK. It is a theme emerging through the Test and Protect work. And so what I would say is that, the 5 health board areas that we talked about last week, Greater Glasgow, Lothian, Lanarkshire and Forth Valley and Ayrshire and Arran. If you live in any of these areas, don't travel outside your own health board area unless you really need to. And people from elsewhere, don't travel into these areas unless you really need to. Now, that's not a mandatory travel restriction. It's not saying you absolutely can't travel, but it's saying judge whether you need to or not. And to the population more generally, if you are travelling, be very, very vigilant and be very careful about all of the advice. So make sure you're wearing a face covering. If you're on a coach anywhere, a bus, a train, anywhere, wear your face covering. Make sure you're maintaining physical distancing. Make sure you're washing your hands really regularly, because these are the things that don't eradicate completely the risk of transmission in these kind of settings, but will reduce it. And that's the advice we're giving to people very strongly. Don't know if you want to say more about coach travel.
So at the moment, what we can say is that we've got evidence of family and friend groups who have participated in coach travel and perhaps gone away on outings together, and subsequently members of those parties have tested positive. Now, as the First Minister has already outlined, we can't be definitive and say that transmission took place on the coach, but it may have taken place on the coach or in the subsequent mixing that took place within those parties afterwards, particularly with the type of venues that those people were travelling to. My advice would be to anyone is to think very, very carefully before participating in any type of travel like that, particularly if you plan to go to areas of the country where there are high prevalence of the disease just now. And we know from reading the media that particularly the north of England and particularly the northwest of England are areas where there are high transmission rates just now. So just to think very, very carefully about the risks that are involved with that, particularly if you yourself carry any additional risk yourself because of either the age group that you're in or because of underlying health conditions that you may have as well.
Thanks. Conor Matchett from the Scotsman.
Thanks, First Minister. Just going back to your opening remarks about the tiering system that's going to be put in place in Scotland in a few weeks, there's a practical question here of, as we come out of these temporary restrictions, will it make a blind bit of difference when these tiering systems are in place, as to what people can actually do? Can you give us a little bit more information and clarification around what they will say and what they will allow people to do, post these temporary restrictions?
I don't want to go too much further before we've actually sort of finalised the proposal, and we're going to put it to Parliament pretty straight after the October recess. And it may not be identical to what is published in England today, but in that strategic sense, we are keen, if we can, to align. So when you see what's published in England today, it gives you an idea of the kind of things we're talking about. I don't want to go into that because it's for the Prime Minister to set that out himself. But if you think about a three-tier level, Greater Glasgow and Clyde right now and the other 4 health boards that have the same restrictions are probably in what will be roughly tier 3 of that. The rest of the country in something that is more tier 2, where we have household restrictions, some hospitality restriction, but not as severe as in these other health boards. And there may be, as we go forward, some, particularly within the tier 3, different levels within that. So it's about trying to give people greater clarity about the levels of intervention that might be required, but there will still inevitably be judgment that is necessary and consultation between national and local government. So we will set that out probably over next week with a view to a debate and vote in Parliament at the start of the week after that. But I would caution against looking at the English proposal and assuming it will be absolutely identical, because we only saw that this morning and we want to work through that properly. But while the operational decisions will be ours, there will be a merit across the UK in trying to have as much alignment on the strategic level as possible. So equally, it's not unreasonable to look at that as a possible direction of travel that we are likely to go in as well. Michael Blackley from the Daily Mail.
Thank you. Good afternoon. As you've just said, we've not yet seen all of the detail of the UK government's 3-tier lockdown proposals. But one of the early suggestions is that bars and restaurants may individually be treated differently. Even in the tightest restrictions, restaurants might be allowed to stay open. Are you convinced that, as it stands, the evidence suggests that bars and restaurants should both be treated identically? And also, in terms of the tightest restrictions ahead, do you think you will need to consider mandatory travel restrictions for red alert areas?
I want to avoid mandatory travel restrictions if that's possible, because I think it is better to ask people to be sensible on an advisory basis. But I suppose I'll answer this similarly to how I answered, I think, David Henderson's question way back at the outset. I'm equally not going to stand and rule it out, because we have to have a flexibility of response. But at the moment, we have advice to people around travel, not mandatory restrictions. But the more people abide by the advice, the more they will, what we're asking people to do will have an effect. On the first part of your question, I'll make a couple of brief points. Firstly, just to be clear, I do believe what is in place in Scotland now is right and necessary for that short, sharp reset to pull things back to a better place that then allows us to emerge after 2 weeks with more resilience, and then we can look at a tiered level going forward. I don't want to go into the detail of what will be announced in England because, well, obviously it's for them to finalise and definitely for them to announce. But one of the things that was, and I think it is perhaps relevant to the bars, restaurants divide, and I don't know what the final shape of that will be in England, or what areas of England may be going into that sort of tier 3 category. But one of the points that was made, and I think broadly accepted on the Cobra call, it was made by some of the professional advisors on the call, is that the very minimum level of the tier 3 that might be published in England today is probably not sufficient to get R back under 1. So probably what you would need is something to be discussed with local areas that is above that bare minimum. But that's obviously, these are the factors we'll take into account when making decisions here. It's for others to reach these decisions in their own way and based on the evidence they have. Adele Merson from the P&J.
First Minister, you said in your opening remarks that self-isolation is an area where compliance is not as high as you need it to be. What do you actually put this down to, and what do you think needs to be done to improve the situation?
What I put it down to is that self-isolation for 14 days is really difficult. I think none of us here have been asked to do it. I'm not sure if anybody on the call has already been asked to do that. But if I think about it myself, being told that you have to stay at home and not go out for any purpose for 14 days is a tough thing. And, you know, for somebody who will continue to be paid during that is tough in itself. But, you know, you've got a degree of protection and assurance there. For people who are on, you know, maybe 0 hours contracts or less secure employment, they may face real financial barriers as well. So what I put it down to is just what a tough ask it is of people. And therefore what has to be done is to make it easier practically for people to do it. The self-isolation support payment comes into force today, the £500 payment for people on low incomes. We'll say more about that at the briefing tomorrow, but that's an important step to try to help people comply. We are also looking to offer people more practical support if they need help with getting food or other essentials delivered. There is a mechanism to do that. Not identical, but similar to the support that was put in place earlier on for people in the shielded category. And we'll be thinking about the different ways in which we support people to self-isolate. So there are things we can do to improve compliance, but that means recognising how difficult it is and the reasons why people might not comply. And also just taken every opportunity to explain to people why it is so important. Because if you think about it logically, if you have the virus or you have been exposed to the virus and you're being asked, if you self-isolate, you are obviously taking away the risk of you passing it on to somebody outside your own household, and therefore you are breaking the chains of transmission. So again, it's something that each and every one of us can do to quite literally stop ourselves passing the virus on to other people. Christian Lavelle from The Sun.
Thank you, First Minister. It was just on Margaret Ferrier. She told us over the weekend that the SNP choreographed her statement and only removed the whip after seeing the public reaction. If it is the case the SNP wrote her apology, why did the party wait until 7:05 that night, an hour and 15 minutes after the statement went out, to suspend the whip until 7:52 for you to condemn her actions? Were you waiting to see the public's reaction? And also, was Ms Ferrier told that she would have the whip restored at a later date because she'd cooperated with the party?
Let me try and unpack that and give you answers to as many bits of it as possible. In terms of my own reaction, I tweeted that night, and to be perfectly blunt about it, I tweeted as soon as I was able to get on Twitter. I do have other things that I have to do on a daily basis that means I don't sit on Twitter literally every minute of every day. So I was I had other business that I was attending to, so there's no great mystery there. That's just the nature of the workload that I have. Ian Blackford spoke to Margaret Ferrier about the removal of the whip, and again, as I explained at the time, Ian was travelling from London back to Skye at the time. Certainly when I was speaking to Ian over the course of that evening, he was going in and out of mobile phone reception because he was travelling through the Highlands. So again, there's no great mystery there. I don't think it would surprise journalists or anybody else that in a situation like this, somebody in her position would be assisted with putting together the actual statement that they were issuing. But equally, it shouldn't surprise anybody that they're given some time in order to alert anybody that they want to alert. So I know there is always a tendency to look for the intrigue behind these things, but sometimes it is just sort of more boring than that, and it's just the logistics and the practicalities that have to be gone through. I don't think the SNP could have been clearer about all of this. Margaret, and you know, it's not difficult for any of us, because for many of us, Margaret is somebody we consider a friend and have known for a long time. But what she did was not defensible because it potentially put people at risk, and it was a clear and flagrant breach of the rules. So she had the whip removed. She was suspended from the SNP. There is a process now. Political parties have to comply with due process. That process will be gone through. And I think she should resign from the House of Commons, but I don't have the power to force her to do that. So we've been pretty clear, pretty robust, pretty tough. No doubt there will be suggestions from people, they may even be in the piece in The Sun this morning, that we've been too tough on Margaret. But in my estimation right now, knowing how important it is for me to be able to encourage other people to do all the right things, then we can't turn a blind eye when somebody acts in such flagrant breach. So that's the position. I hope it's helped to outline it again, and I would continue to say that, difficult though a decision I know it would be for her, she should do the right thing and resign as an MP. Tom Martin from the Daily Express.
Hi, thank you, First Minister. Just returning to the hospitality restrictions, and obviously it was raised earlier, just some of the ongoing concern about how this is being applied on those who may fit in or fall, sort of slightly fall into one category or other. Isn't part of the problem with that the lack of consultation that there was around businesses in the drafting of this? This morning we've had Douglas Ross calling for a new advisory council to be created to give firms a greater say in the drafting and setting up of some future regulations. He argues, firms have been sidelined a lot of the time. Is he right? And what more could be done to involve firms and keep them on side and getting these things done?
To be fair to Douglas, I've not had a chance to see the detail of what he said. I've seen some, headlines of it on social media just before I came to the briefing, so I won't. I'll take the time to look at it. I do think it is important that in a situation like this, and I'll come back to some of the limitations of this in a second, we try to consult as much as is feasible. We try to take as many views as possible. Last Monday evening, so a week ago tonight, 2 days before we announced the restrictions, I actually spoke to all of the other party leaders on the phone, including Douglas Ross, to take their sense of what was right and wrong to do. One of the reasons, not the only reason, I hasten to add, because these things have to be public health driven, but one of the views that was expressed on that call, not by everybody, but by some, and I won't go into any more detail, was a real reluctance to have firm travel restrictions imposed. So we try to take account of as many views as possible. But we are up against an infectious virus, and that means we have to be able to act quickly and flexibly. The headline I did see about Douglas's speech this morning was that we should have a week's notice period before, between announcing any restrictions and introducing those restrictions. And, yes, we want to give businesses as much notice as possible, but the virus doesn't stop spreading while we give people notice of changes. And that's the other thing we've got to take account of and balance, factor into these decisions. We, as I said last week in the evidence paper that Gregor and others put forward, we have a doubling time of this virus right now of not much more than a week. So if we decide we need to do something to stop the virus spreading, but take a week to do it, we could have doubled the number of infections in that period. So in principle, yes, I absolutely agree that we have to do as much as we can about consultation and involvement and engagement and learn from experiences about how we can do things better in future. I readily accept that. I just ask people to recognise that this is not a normal situation we're dealing with here. It is a rapidly spreading infectious virus, and therefore sometimes just speed of action and being able to be very flexible in what you do and to do it quickly is more important than anything. Do you want to add anything about speed of response? Or?
So one of the things that we know about this virus is that if we don't act quickly when we think that we need to, before we know it, more people will have contracted it, more people will become ill, and more people will die as a result of that. The current doubling estimate for the virus in Scotland just now is somewhere between 8 and 11 days. That's a growth rate of somewhere between 6 and 9% per day. Delay in action only leads to more cases and only leads to more morbidity, mortality and sadness across the country. And whilst I recognise that consultation process is a really important part of this, we need to balance that with the public health impacts that this virus still has upon our community out there.
Daniel Sanderson from The Telegraph.
Thank you very much, First Minister. Just to follow on your response to Alan Smith, as someone with a legal background yourself, obviously, are you entirely comfortable that the cafe rules are being sort of enforced and interpreted based on what you say or an interpretation of the spirit of what you say, rather than what the law actually says, where there seems to be a fairly wide sort of interpretation of what could be a cafe? Couldn't this just lead to legal action and ultimately put put public money at risk? And also for cases where a business thinks they've genuinely been hard done by, what's your advice to them and to council? Should there be a sort of formal appeals process, or are you saying they should just, accept the decision?
I don't think I'd describe myself as entirely comfortable with anything that we're going through right now. This is not a position I want to be in. I would dearly love not to be in a position of standing here talking about the implications of a decision to close down sectors of our economy. So I don't think that's terminology I would use or associate myself with. This is really, really difficult. And when I talk about how difficult the decisions are, that has nothing compared to how difficult it is for those who live with the consequences of those decisions. And I know that we are trying our best to reach the best balance. I spoke last week, not to sound dramatic about it, but to try to give people an understanding of what it is we're trying to do here. Every day we look at decisions and it's lives here and jobs there, and we're trying to strike the best balance we can. And I don't think it is possible to get a perfect balance when those are the invidious decisions you're making. What I would say to businesses, though, is these reset restrictions are for a 2-week period. They are essential to try to reduce the volume of interactions. And if everybody complies with the spirit of them and what we're trying to achieve, then we reduce the prospect of having to have restrictions like these in the future. So I know it's really difficult for businesses, but it is about trying to avoid restrictions like this being needed for a longer period of time, and perhaps even tougher. And going back to a difficult point that I made on Friday, because we have to reduce the volume of places where people are interacting right now, it was never an option to go in the other direction and just exempt a bigger section of premises. So if people think that the lack of clarity, to use the term people have used, is a problem, what we would have had to do is go in the other direction. And so businesses that are perhaps feeling as if it is unfair that they are on the wrong side of the cafe definition, had we just decided to close every cafe with a licence, these businesses would have fallen within that. So this is tough, and that's why the financial support is so important. But it is for a reason, and it's for a really important reason, because if we don't get the spread of cases that we're seeing right now, the rate of increase of infection back under control, if we don't stem that, then we'll all be in a worse position going forward. So I would appeal to businesses, even if you, as I'm sure many of you do, hate what you've had to do over the past couple of days, don't lose sight of what it is about and what it is trying to achieve, which is a lot of pain for a lot of businesses now, but to get the gain of not having a longer period with restrictions like this in place. Tom Gordon from the Herald. Tom, are you there? Right, I'm going to skip over unless that is Tom appearing now.
Can you hear me now, First Minister?
I can hear you. Yes, I can see you as well now.
Okay, thank you very much. You mentioned earlier about cutting people's slack. In your Sky interview yesterday, you were asked at length about the Alex Salmond inquiry. It seemed to be getting under your skin. It seemed to be adding to the general stress of the job, which is obviously pretty intense already. Has it become a distraction to you in the course of the pandemic? And if it's not at that point yet, would you like Mr. Salmond and his proxies to give it a break and cut you some slack before it does?
Look, Tom, I'm not going to get into other issues today for reasons that I've set out before. This is a COVID briefing where people look to me for COVID advice. Well, if you let me, I'll try not to show elevated stress when I'm answering your question here either. It hasn't been a distraction. I'm focused on dealing with the pandemic, and whether you're one of the people, going back to Gordon's question earlier on, whether you're one of the people who think I don't get anything right, or one of the people who think I get everything right, or the vast majority who probably think it's somewhere in the middle, I think everybody would see that I'm pretty laser focused on dealing with this pandemic. I'm not in control of the questions I get asked in television interviews, and I will answer questions as fully as possible. I do try at these briefings not to get dragged into other areas for the reasons that I've already set out. So it's not a distraction. There is nothing more important that I have dealt with or will deal with over this period than continuing to try to navigate the best possible course for the country through this pandemic. And, you know, other people will make their own decisions about the things that they want to focus on, but that's what I'm going to focus on, because I think it's what the country expects of me, and will continue to expect of me for as long as we've got this pandemic to deal with. Mark McLaughlin from The Times.
Good afternoon, First Minister. Around about this time of year, people will be thinking about travelling to other parts of the UK for Christmas and coming the other way, you know, people that live in England coming to visit family in Scotland. What would be your advice to them who, you know, you have to plan in advance to book flights, etc. And also, given that this kind of partial shutdown that we're having just now has been spoken of as a kind of price to pay for a kind of semi-normal Christmas. What do you think a semi-normal Christmas will look like? What do you aim to have? Is it unlimited family gatherings? Is it a rule of 12? Is it something like that?
Again, Mark, I hope you will accept when I say I'm not trying to dodge this question. But equally, I don't think it is helpful for anybody for me to get ahead of where we are. I know that in the normal course of events, by the time we get to where are we now, heading to mid-October, people are starting to think about Christmas. I know that, but this is not a normal year. And in the context of a pandemic, Christmas is still some time away, and it is going to be important over the next few weeks to give people clear advice and clear steers and parameters in which we can all try to have the best Christmas possible. But I think it is really important that we work our way through that for the next couple of weeks. Focusing on trying to stem this increase is the most important thing we've got to do right now. And the more successful we are and the more effective we are at doing that, the greater the prospect of having a Christmas that might not be 100% normal. Nothing's 100% normal right now, but closer to that than it would otherwise be. You're asking me what I'm aiming for. I want people to get to Christmas, and for all of us, myself included, to be able to enjoy it as freely as possible. That is unlikely to be exactly the same as it is outside a pandemic, but to be as close to that as possible. But what that means in rule of 6, rule of 12, you know, people travelling, I cannot say that definitively right now, and I don't think it's fair to people for me to fly kites about that. Instead, I think it is much fairer for us to work through these next couple of weeks and over the period to start to firm up on the advice we're able to give to people. But my objective is to try as hard as we can, although I need everybody's help in this, is for all of us to get a bit of respite over Christmas and be able to have some, you know, time with those we care most about, and something that is recognisable as the kind of Christmas we all want to see.
So in terms of booking flights now, is your advice, just don't do it?
Mark, I stand here and say I advise people against overseas travel that is not essential right now, and I'm asking people to think very carefully about travel that is not needed. And within the 5 health board areas that have tougher restrictions right now, that is particularly the case. So err, if you are, you know, making decisions right now, err on the side of caution at the moment. I would hope in, you know, the weeks to come to be a bit more free in the advice we're giving people about the Christmas period. I recognise in a 7 months, 8 months as it's almost is now, of real pain for a lot of people. I absolutely recognise, I hear it from my own relatives, as we start to think about Christmas and the prospect of not being able to do what we all take for granted and love, that just starts to feel really horrible. And I understand that, which is why it's more important, or so important for me over this next period, to try to give people, when I'm able to do that, some firm advice rather than getting into too much speculation at this stage. And I know that's not ideal for people who are trying to make plans, but we are in the situation we are in, and we have to try and get through it as best we can. So I will try to say more about Christmas over the next few weeks. But can I say, I've said this already a few times today, the more we all comply with the restrictions right now, painful though they are, not getting into each other's houses now, then I can't guarantee that it's it's markedly different by Christmas, but there's more chance of it being different. So stay out of each other's houses right now, and it makes it more likely that we'll be able to see friends and family a bit more normally closer to Christmas. And it's another reason why taking some of this pain now for the gain of greater normality later is worth doing, given what later is in the context of standing here in mid-October. Thank you very much, and I absolutely, and to Mark and to others, I understand the desire for, you know, clarity and definitive information, and we try to do that as much as possible. But I've tried all along as well not to say things just because I know people desperately want to hear them, if I'm not in a position yet of giving that definite advice. But we will, over the next period, try to talk more about Christmas and work our way through to giving people an idea of what Christmas will be able to look like, and the changes that we might all have to factor into our planned celebrations. Thanks to all the journalists today for the questions, and thank you to everybody for joining us, to Gregor, Jeane and Jill for our BSL interpretation. Please stick to all of the restrictions. It is really important, but it also does increase the prospect of getting back, not to 100% normality by Christmas. I don't think that is likely, for the reasons Gregor was talking about earlier on, but getting back to a bit more normality for Christmas. The more we stick to these restrictions now, the greater the chance there is of that happening. So please remember to stay out of each other's houses. If you are, well, wherever you are, abide by the hospitality restrictions. That's obviously more stringent in the 5 health board areas in the Central Belt. Work from home if you can, wherever you live in the country, and remember facts. The face coverings, avoid crowded places, clean your hands and clean hard surfaces, 2 metres distancing from those in other households, and self-isolate and get tested if you have symptoms of the virus. Thanks very much for joining us, and I'll be back here with you at 12:15 tomorrow.